We are facing a silent epidemic that is often overlooked. It affects millions of people worldwide, cutting across all demographics and age groups. This epidemic is insulin resistance, a condition that disrupts the body's ability to manage blood sugar levels. It often goes undetected until serious health problems arise, such as type 2 diabetes and heart disease. Understanding insulin resistance is crucial for maintaining overall health and well-being. Early diagnosis and intervention can prevent life-altering complications and improve quality of life. We need to bring this hidden health threat to light and make it a priority in public health discussions. We need to understand its causes, symptoms, and the risk factors that contribute to its development. Most importantly, we need to know how to prevent and treat it through lifestyle changes and medical interventions. Knowledge is power. Empower yourself with the information you need to live a longer, healthier life, free from the complications of insulin resistance. This essay will delve into the depths of insulin resistance, providing you with the tools to take control of your health. We'll explore its impact on your body, the factors that contribute to its development, and the latest research findings. We'll also discuss how to recognize the warning signs and the steps you can take to protect yourself and your loved ones from this pervasive condition. Insulin is a hormone produced by your pancreas. Think of it as a key. It unlocks the doors of your cells, allowing glucose or sugar from the food you eat to enter and provide energy. This process is essential for life. Insulin resistance occurs when your cells become resistant to insulin's message. The key no longer unlocks the door efficiently. This causes glucose to build up in your bloodstream, leading to elevated blood sugar levels. Over time, this resistance can lead to a cascade of health problems. Your pancreas works overtime to produce more insulin to compensate. Eventually, this can lead to prediabetes and type 2 diabetes, but the risks of insulin resistance extend far beyond diabetes. Insulin resistance is often silent in its early stages, making it difficult to detect without proper awareness. However, your body may give you subtle clues that something is amiss, which can be easily overlooked if you're not paying attention. Recognizing these signs is vital for early detection and intervention, as it can help prevent more serious health issues down the line. One of the most common symptoms is weight gain, particularly around the abdomen, which can be stubborn and hard to lose despite efforts. You may also experience increased fatigue and low energy levels, even after a good night's sleep, making daily tasks feel more challenging. Skin changes, such as darkening of the skin on the back of your neck or under your arms, known as acanthosis nigricans, can also be a sign of insulin resistance. Frequent urination, especially at night, is another potential symptom that should not be ignored. Additionally, increased thirst and cravings for sugary drinks can indicate your body is struggling to regulate blood sugar levels effectively. If you notice any of these symptoms, it's essential to consult with your healthcare provider promptly to discuss your concerns and get appropriate tests done. While the exact causes of insulin resistance are complex and not fully understood, several factors can increase your risk. These can be broadly categorized into lifestyle factors and genetic predisposition. Obesity, particularly excess abdominal fat, is a major risk factor for insulin resistance. A sedentary lifestyle with minimal physical activity also significantly increases your risk. The food you eat plays a crucial role. A diet high in processed foods, sugary drinks, and unhealthy fats can contribute to insulin resistance. Genetics also plays a role. If you have a family history of diabetes, insulin resistance, or heart disease, you may be at increased risk. Certain ethnicities, such as African Americans, Hispanic Americans, American Indians, and Asian Americans, are also at higher risk. Section 5. The domino effect. Complications of untreated insulin resistance. Insulin resistance is like a domino effect, potentially triggering a cascade of health problems if left unaddressed. When your body becomes resistant to insulin, it struggles to manage blood sugar levels effectively, setting off a chain reaction of health issues. Over time, the strain on your pancreas to produce more insulin can lead to prediabetes and eventually type 2 diabetes. This condition forces your pancreas to work overtime, trying to keep up with the body's demand for insulin. But the risks don't stop there. The complications extend far beyond diabetes. Insulin resistance is a major contributor to heart disease. It can cause inflammation and damage to the blood vessels, making it a significant risk factor. It increases your risk of high blood pressure, high cholesterol, and atherosclerosis, which is the hardening of the arteries. These conditions can severely impact your cardiovascular health. This can lead to heart attack and stroke. The blockage of blood flow to the heart or brain can have devastating consequences. Non-alcoholic fatty liver disease, or NAFLD, is another serious complication. This condition is characterized by the accumulation of fat in the liver, which can disrupt its normal function. This condition involves the buildup of fat in the liver, potentially leading to liver damage, cirrhosis, and liver failure. Over time, the liver's ability to function properly can be compromised. Insulin resistance also increases your risk of certain cancers, including breast, colon, and prostate cancer. The link between insulin resistance and cancer is an area of ongoing research, but the evidence suggests a strong connection. Section 6. Taking charge. Treatment options for insulin resistance. The good news is that insulin resistance is reversible. With early intervention and lifestyle modifications, you can regain control of your health and prevent or delay the onset of serious complications. The cornerstone of treatment is lifestyle changes. This includes adopting a healthy diet, engaging in regular physical activity, and losing weight if you are overweight or obese. Medications may also be prescribed in some cases to improve insulin sensitivity or manage blood sugar levels. It's important to work closely with your healthcare provider to develop an individualized treatment plan. They can help you set realistic goals, monitor your progress, and make adjustments as needed. Remember, managing insulin resistance is a lifelong journey, not a quick fix. Section 7. Prevention, your best defense against insulin resistance. The old adage prevention is better than cure holds true for insulin resistance. By adopting a healthy lifestyle, you can significantly reduce your risk of developing this condition and protect your long-term health. Making gradual, sustainable changes to your diet and exercise habits is key. Focus on consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit processed foods, sugary drinks, and unhealthy fats. Engage in regular physical activity most days of the week. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities at least 2 days a week. Section 8. Small steps, big impact. Simple lifestyle changes for prevention. Preventing insulin resistance doesn't require drastic measures. Small, sustainable changes to your daily routine can make a world of difference. Start by finding ways to incorporate more physical activity into your day. Take the stairs instead of the elevator, park farther away from your destination and walk the remaining distance. Walk around while talking on the phone. Every bit of movement counts. Make it a family affair by going for walks or bike rides together. Incorporate strength training exercises into your routine at least twice a week. This can help build muscle mass, which improves insulin sensitivity. Simple body weight exercises like squats, lunges, and push-ups are a great place to start. Section 9. The power of food, dietary strategies to combat insulin resistance. Your diet plays a pivotal role in preventing and managing insulin resistance. Embrace a balanced eating pattern that prioritizes whole, unprocessed foods and limits added sugars, unhealthy fats, and processed ingredients. Fill your plate with colorful fruits and vegetables. Aim for at least 5 servings per day. Choose whole grains over refined grains. Opt for brown rice, quinoa, oats, and whole wheat bread. Include lean protein sources in your diet, such as fish, poultry, beans, lentils, and tofu. Healthy fats are also important. Incorporate sources like avocados, nuts, seeds, and olive oil. Stay adequately hydrated by drinking plenty of water throughout the day. Section 10. Moving towards health, exercise, and insulin sensitivity. Exercise is not only beneficial for weight management, but also plays a crucial role in improving insulin sensitivity. When you engage in physical activity, your muscles use glucose for energy, helping to lower blood sugar levels. Aerobic exercise, such as brisk walking, running, swimming, and cycling, is particularly effective in improving insulin sensitivity. Aim for at least 30 minutes of moderate intensity aerobic exercise most days of the week. Strength training is also essential. It helps build muscle mass, which improves insulin sensitivity and boosts your metabolism. Include strength training exercises that target major muscle groups at least 2 days a week. Section 11. A brighter future living well with insulin resistance. Insulin resistance is a serious condition, but it's not a life sentence. With the right knowledge, lifestyle modifications, and support from your healthcare provider, you can live a long, healthy, and fulfilling life. Remember, you are not alone on this journey. Millions of people are affected by insulin resistance, and there are countless resources available to support you. By taking proactive steps to manage your health, you are investing in a brighter future. Start by scheduling an appointment with your doctor to discuss your risk factors and get personalized advice. Together, you can develop a plan to achieve your health goals and live your life to the fullest.